I'd just like to congratulate everybody that's made an effort to be here today, and I apologise if I can't see you or if you can't see me, but to Joe Mitchell, to Megan Cobcroft, to the health team that have had to move this venue, I think, 3 times to cater for the increasing number of people that wanted to attend the New South Wales Food Forum. Thank you for the effort that you've gone to. And I think part of what I'm going to talk about, and certainly what the guest speakers are going to talk about, and hopefully the interaction within the panel, will allude to the fact that we are taking the issue of food integrity, but also the issue of preventative health and obesity very, very seriously. So I just want to say thank you up front for that. I always like to start with a few anecdotes of my area. That is right, Adam, it's nearly 30% of the state, and if my redistribution goes ahead, it'll be half the state, literally. So it'll be Broken Hill in the west to Narrabri in the east. So it's quite a diverse area, not made up of any cities. But up until a few years ago, my electorate had no fast food takeaways. We had no quick service restaurants. But did we still have an obesity problem in Western New South Wales? Absolutely we did. And still do. Do we have a diabetes issue, type 2, particularly out of control in some of our Indigenous communities? Yes, we do. And some of the raps that the food industry gets, I think, are sometimes ill-founded. I can easily mount an argument to say that quick service restaurants and all the takeaway baggage that tends to go sometimes with that labelling, literally that labelling, is not necessarily true. And I think when it comes to issues around food integrity and lifestyle, we need to peel back the layers a little bit, target personal responsibility in particular and community responsibility, and look at more evidence-based facts on what people's behaviour is actually like. Because if through the portfolio of healthy lifestyles, and healthy lifestyles includes Indigenous health, oral health and preventative health, then really what are we targeting? Well, we're targeting behavioural change, to be honest. We move around on issues around labelling. I've got no issues with that. What goes into our foodstuffs, how it's presented, how we educate and advocate for people in that space. Fundamentally, it's all fundamentally important. But if it's not all drawn together in an educative sense, so we're educating people about the impacts of what they're doing to themselves and what it's likely to lead to in the short and the long term, if we don't do that together, as industry, as advocates, as government, as clinicians and as community people, we're not going to make the changes that we need to make, particularly, as Adam alluded to, in a sedentary Western-style community, where we're encouraged to be more passive than active. So one of the things that we did in opposition, knowing coming into government, was to target the issue of preventative health. Part of the relationship we have at the state level is I've got to say, quite a productive relationship with the federal government through the Office of Preventative Health, and we're able to, through a national partnership agreement, a contract with the federal government, to work together on that whole issue of chronic disease, and issues around promoting better health and healthier lifestyles. Happy to say that a lot of the work that's been done by previous governments and entities, whilst it's tended to be disparate, has actually led to some better outcomes for younger people. So issues around obesity for younger people have tended to plateau, and hopefully, like the smoking campaign, if you want to draw an analogy, those numbers in New South Wales are continuing to fall. So that's through a lot of effort within the school climate, and certainly through sporting groups. And interestingly, adults knowing what's best for their kids, not necessarily knowing what's best for themselves, a bit like do as I say, not as I do. Because the obesity and issues around diabetes type 2, for instance, for adults is actually increasing. So if our obesity rates, as we describe them today, around 22-23% for younger children, and plateauing and dropping in some of our communities they're not though, so that's a bit of a challenge for us. For adults, it's still stubbornly well over that 50% and increasing. Now that's a problem, and that's the behavioural change that we want to target. Part of the strategy that we wanted to undertake was recognising that fact that the adult population is the stubborn population. And if we're talking about behavioural change, that's really where we need to develop a further focus and intensity. So through the healthy eating and active living strategy is our main strategy that we're using in New South Wales. It's targeting in particular obesity levels and preventative health outcomes, better outcomes for adults. Part of that, as you would know, and some of the people in this room, whether it's the Get Healthy coaching line, we've had 25,000 people go through that coaching line now, on average losing 4 inches across their waist, around their waist, and 5 kilos in that first year. We know that is working. We've intensified that, and we've gone into a new contract with Healthways in providing that service. We've also added components for people of a second English-speaking background. We've also added components, more culturally based components for Indigenous people as well. So the Get Healthy coach line is something that we will continue to expand across the state, and a couple of other states are looking at how that program's working as well. Some of you would be very familiar with the 8700 campaign. The 8700 campaign started by the previous government has been expanded, and it's been very successful, I've got to say, getting people used to counting their kilojoules and looking at what's an average intake. And we know that is working and will continue to work, and certainly the Health Minister and the Primary Industries Minister are very involved in that continuing process. One of the things I'm asking and I haven't done it formally yet, but we've had some informal discussions between three peak groups, being the Cancer Council, the Heart Foundation and the Diabetes Council of Australia, because we're doing a fair bit of community work out there with those people, is to come together on a couple of common outcomes. And one of the common outcomes that I think we all need to do, and it's something, whether you're a food retailer here or a dietitian or a consumer, is that we've got to challenge the average Australian what it means to look like as an average healthy person. Because as our Western society continues to emerge and things tend to get easier for a lot of people, and our medication's getting better, and that's the irony, people living with chronic disease are still living longer for other reasons. They're living more complicated lives, I've got to say. But we've got to challenge what is a healthy weight, what is a healthy size. 8700 starts to target what is a healthy portion size. And I was very pleased to hear this morning that Joe cut the size of the muffins in half because it did not meet the Heart Foundation's guidelines, which we're working through here today. So it's just a practical way of how do we challenge what is an acceptable portion size. And I think you'll start to see more of that coming through, whether it's in school canteens, whether it's in retail shops or even in supermarkets. That's got to be challenged. But the other side is, and this is the psychological side of behavioural change, we've got to challenge what is a healthy weight. Because Australians increasingly, it's like boiling a frog, slowly, are being led into this delusional view that increased weight and being bigger is healthy. Now, we're being led into that from a whole lot of fronts, whether it's advertising, whether it's just our sedentary lifestyle, whether it's having more disposable income. 40 cents in every dollar of disposable income is spent on takeaway food in this country. That is enormous. It tells me that we live in a very affluent society. We're potentially a little bit lazy, and coming from a farming background in a rural community, that food possibly is a little bit too cheap. So is that a challenge that we need to focus on as a group? Yes, we do. So if anything can come out of today, and I know you're going to have some wonderful speakers, it's about challenging, I think, human behaviour and taking personal responsibility and collectively looking at that whole image of what is a healthy person living in Australia in the 21st century. I was talking to a group of young women the other day, and this is what blows me away, because I think women are far more image conscious than men, though I think men are catching up, I've got to say, with some of the things I see these days. And one of the girls was talking about how, if you say to another female, she looks a little bit overweight, all the other girls will say, and they all said it, oh, no, she's not, she looks really good. And they were starting to have a conversation about what is a healthy weight and what's a healthy image. And it got shut down very, very quickly. And that's the conversation I think we need to not go in and target young women, obviously, but I think in terms of our everyday conversation, it's a conversation that we need to have. So just in summing up, Adam, I just want to congratulate you for all being here today. I think it's a sign of the times that we've got a very large number of people that are representing all facets of our community here today. People that are out to make a dollar, people that are really, really interested in food integrity, people that are struggling with preventative health issues and want to change their life and want to do something about it and need a hand, and people that just want to live in a community that is healthier and safer and more active. So I congratulate you on all being here today, and at the end of the day, hopefully, and I'm sure Adam will lead us to that point, we want to target half a dozen outcomes that people are unified on. And I think by the presence that I see here today, you're going to get to that point. So well done, and it's my privilege, I've got to say, to open really the first New South Wales Food Forum that we've had here that targets the first strategy that we've had, particularly for adult obesity in any state. And we're very serious about moving your issues and your recommendations on to the next level. So congratulations and thank you for being here.